Okay, take two. Not all patients in need of healthcare information can easily grasp the concepts provided during patient teachings. Nurses have a responsibility to present health-related information to patients and their families, and to do everything possible to ensure their ability to comprehend and integrate the information. To teach effectively, nurses must recognize that patients of all ages come from diverse cultural, educational, and socioeconomic backgrounds. Each has a different ability to comprehend healthcare information. The unique ability of a patient to understand and integrate health-related knowledge is known as health literacy. Health literacy is about patients understanding medical information from the healthcare team or other sources and using that information to make informed decisions about their care and course of treatment. The health literate care model is a model developed to assist healthcare organizations integrate health literacy as an outcome measure, integrating the concept as an organizational policy. Before the proposal of this model, the most recent comprehensive data exploring health literacy in the United States was from a research project called Assessing the Nation's Health Literacy. Key concepts and findings of the National Assessment of Adult Literacy, NAAL, which was conducted in 2003. The NAAL was the first assessment of the nation's progress in adult literacy since the National Center for Education Adult Literacy Assessment performed a decade earlier, the 1992 National Adult Literacy Survey, NALS. Results of the NAAL research indicate that among American adults, 30 million, 14%, had below basic health literacy in English, and 47 million, 22%, had basic health literacy. This means that 77 million, 36%, of American adults possessed very rudimentary literacy skills that allowed them to read only short, simple, printed, and written material. Nurses have been providing educational information to patients since the late 1800s, but health literacy is a recent concept. Florence Nightingale's effort incorporated the importance of patient education into the nursing profession. Chapter 1 provides additional information on Nightingale. Although discussion of Nightingale's work often focuses on her efforts to distinguish nursing as a profession and address the impact of sanitation on health, she advocated exploring all aspects of the patient. She thought that patients needed care that is delicate and decent and demonstrates the power of giving real interest to the patients. Exploring patients' interests and abilities was an early acknowledgement that nurses must be aware of patients' ability to comprehend the healthcare information provided. The realization that consumers need to be able to understand the medical information delivered by healthcare providers has gained recognition at many governmental levels. The Health People 2020 publication describes a national movement that addresses the priorities of prevention and public health in the United States. Health literacy, with its impact on this initiative, is being recognized and has become a key component of the project. As the healthcare community explores the concept of health literacy, many organizations recognize that before improvements can be made, operational definitions are needed. A global definition of health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. In exploring communication patterns and techniques between healthcare providers and patients with low health literacy, Schwartzberg defined health literacy as an individual's ability to read and understand health information and use it to make appropriate health decisions. Low health literacy refers to the condition in which individuals are unable to comprehend health-related information or instructions and may fail to make appropriate decisions regarding their care. The results obtained in their study further explain that although low literacy and low health literacy are related terms, they are not interchangeable. Low health literacy is content-specific, meaning that the individual may not have difficulty reading and writing outside the healthcare arena. These patients may struggle to comprehend the complicated, unfamiliar terms and ideas found in health-related materials and instructions. Interest in effective patient education is not a phenomenon unique to the United States. Sorry. The Institute of Medicine, now National Academy of Medicine, Roundtable on Health Literacy held a workshop in 2012 focused on international literacy. The workshop combined the strengths of the United States research, Europe's multilingual and multinational experience, and developing countries' community-based programs. Nurses should recognize that there are several definitions of the term health literacy. Role of health literacy in nursing and patient education. Understanding that effective patient education is key to health promotion and wellness, nurses must be aware of the concept of health literacy and to determine how it affects the care of every patient. Nurses take primary responsibility for patient education. Often, healthcare professionals assume that the explanations and instructions given to the patients and families are readily understood. In reality, research has shown that these instructions are frequently misunderstood, sometimes resulting in serious errors. As part of the healthcare team, nurses have directed contact with patients and their families throughout the lifespan. Teaching that is not effective can have negative implications, as Quilati describes. Health literacy is a significant concern for Americans. Understanding health information is vital in addressing issues of access, quality, and affordability. If nurses are not able to teach patients effectively about their conditions and treatments, outcomes will be adversely affected. Providing information in ways that are appropriate for the patient's health literacy level is a step toward decreasing health disparities and increasing patient compliance. Preventing disease, promoting health, providing treatment instructions, clarifying information, and teaching patients to cope with the limitations are all components of patient education. In exploring disease prevention, consider the complexity of immunization information given to parents regarding their child. The volume of materials, including the rationale for giving vaccines and the potential side effects and risks, can be overwhelming even for parents with no literacy challenges. Imagine the difficulty parents have if they are unable to read or write or unable to understand the language or reading level in which the instructions are given. Health promotion activities such as smoking cessation and weight management and management of conditions such as diabetes, chronic renal failure, and heart failure are examples of areas affected by a gap between healthcare teaching and the patient's health literacy. For example, the new diabetic patient may be given extensive teaching regarding care, but may not understand all of the information. If the patient is sent home with reading materials but has difficulty reading or seeing a gap may exist. Treatment instructions are another area in which nurses teach patients about some component of their health. Examples include preoperative instructions, those before a procedure, and those given on discharge from the hospital, urgent care, or emergency department. Misunderstanding instructions in any of these settings can be detrimental to the patient. An example of a gap between the healthcare information provided and the health literacy of the caregiver is seen in this scenario. A toddler was diagnosed with an inner ear infection and prescribed an antibiotic. Her mother understands that her daughter should take the prescribed medication twice each day. After carefully studying the label on the bottle and deciding that it does not tell how to take the medicine, she fills a teaspoon and pours the antibiotic into her daughter's painful ear. Although the child's mother was able to read, she did not understand that the medication was to be taken orally. If the healthcare provider caring for this patient had written out the words by mouth rather than using the medical abbreviation PO, the situation could have been avoided. Most likely, the nurse, physician, and pharmacy staff had opportunities to review prescription details, including the route of administration, with the toddler's mother. Having the mother verbally repeat instructions is another method of ensuring accurate comprehension. All healthcare providers have a responsibility to provide instructions that are consistent with the patient's health literacy. According to the Health People 2020 initiative, health information and the associated access issues have become more complicated. There are many considerations when determining whether an individual has proficient health literacy. The patient should be able to exhibit certain competencies. Read and identify credible health information, understand numbers in the context of the patient's healthcare, make appointments, fill out forms, gather health records, and ask appropriate questions of physicians. Advocate for appropriate care, navigate complex insurance programs, Medicare or Medicaid, and other financial assistance programs. Use technology to access information and services.